DocTalk is brought to you by Multimin USA, manufacturers of Multimin 90, Sure Trace Mineral Supplementation by Timed Injection.
Hi there and welcome to DocTalk. I'm Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University. Sure glad you joined us. Going to have a great show. I got Dr. Chris Reinhardt here today from the Animal Science Department, and we're going to talk about implants and how you should use them throughout the life of your calf. Stay tuned.
The year that we administered Multimin to the heifer's calves, we discovered that those cattle were able to, they were just a lot healthier cattle, and we just did not experience the scour problem or other problems too. It just seemed like they were a lot healthier cattle. Well, we sure feel that Multimin has been a real value to this ranch.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value. This segment is brought to you by Norbrook Laboratories, manufacturers of Normycin LA, Normectin Plus, 1% and Poron, the practical choice for your herd. Hi there and welcome to DocTalk. Chris, welcome to DocTalk.
Glad to be here.
Well, it's always good to have you. And you are an associate professor.
Yes, sir.
Over in the Department of Animal Science and Industries, and you're also our state nutrition specialist or feedlot specialist for the state of Kansas.
Yes, sir.
Do a lot of work out in the field, do a lot of work on campus, off campus, and kind of translating research to action.
Yeah, it's a lot of fun.
It's good. We've been doing a lot of work with BQA lately. We've been doing a lot of work with the drought stress, nutrition programs, nitrates, and I thought we'd switch gears and go on to something. Let's anticipate we're gonna get some snow and some rain, and we'll move on to another.
Think positive.
That's right, positive thinking. So we're gonna think about moving forward in that calf crop. And one of the things that I'm asked a lot, and I know you are too, is we know that we need to use steroid implants, but exactly what kind of programs are being recommended out there? And not to put you on the spot, but we're probably going to go through some of your recommendations and some of the myths and theories about steroid implants.
Excellent.
When you, one of the questions I get right off the bat is, okay, calves are going to be born this year, and I don't know whether I should implant the calves on the cow or not. And what are some of the positives and negatives to using steroid implants on calves while they're still suckling?
I don't know many negatives to think of. The positives are extra weight gain. What an implant does even in that baby calf is it takes those nutrients and really allows that calf to utilize those more efficiently for putting on muscle and maybe putting on a little less fat. The net result is that calf is going to be something between 15 and 25 pounds heavier at weaning time from the use of that implant.
Pretty important, pretty big jump.
And this year we're anticipating that being worth a lot of money, right?
Yep, sure are. And so then we start to think about, okay, well, there are different types of products out there. What kind of products are we looking at when we're implanting these suckling calves?
I try and make things as simple and clear as possible. That's what people need, and that's what people remember. And the simple way to put it, Doc, is that we have products available that are really proportional to the animal's size and nutrient intake. And so what I recommend in a suckling calf is a very mild implant. I kind of categorize them as mild, intermediate, or high potency. And so we've got a number of very good products that fit in that mild category. We've got a small calf eating a little bit of nutrients. Let's use a mild implant.
Cool. Well, so when we come back, I think we'll continue this discussion because we'll have to talk about when do I do it, is there a re-implant, different things like that, and then we'll move on into weaning.
Excellent.
Appreciate you being here.
Glad to be here.
Appreciate y'all watching us. Thanks for watching DocTalk. We're going to be back in just a minute here after the break.
Got cattle? Rotomix manufactures a complete line of energy-efficient rotary and vertical feed mixers for feedlots, beef production, dairy, and cow-calf operations. Our mixers are available with the patented Generation 2 staggered rotor, the industry standard for feeding wet rations that include wet distiller's grain. Made in the USA, Rotomix mixers are designed for feeding performance that American cattlemen and dairy producers have come to expect. Rotomix, proud to offer a better mix in less time using less fuel.
Beef producers need a practical choice when antibiotic therapy is required. More than ever, they are reaching for non-prescription Noromycin 300LA from Norbrook, specially formulated to produce sustained antibiotic blood levels up to 4 days in cattle. Noromycin 300LA delivers economic, broad-spectrum disease management for pneumonia, shipping fever, pink eye, wound infections, and foot rot. See for yourself why Norbrook's Noromycin 300LA is the practical choice for your herd.
This hog is head over hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com. Brought to you by America's soybean farmers and their checkoff.
This segment was brought to you by Brute Cattle Equipment, makers of the Brute Stealth Hydraulic Chute. If the chute fits, swear by it. Visit our website for more information.
Hi there and welcome back to DocTalk. I'm Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University, and I'm joined by my colleague and friend, Dr. Chris Reinhardt, who's an associate professor over in the Department of Animal Science and Industry. And Dr. Reinhardt is also our state feedlot specialist. And so we're talking about things before the feedlot,
Yes.
since you're the feedlot specialist.
It all ties together, Doc.
So then when we're looking at different implant programs, and we've established that we do want to implant these calves, and we're going to use a low or mild potency steroid implant, and people can work with their veterinarian or nutritionist to determine the implant that's appropriate. Now, when do you administer these steroid implants on these calves?
Because of how that calf develops, we typically recommend they don't get an implant before 2 months of age.
Okay.
There's just not enough going on in terms of nutrient intake and growth. The growth is very slow up until that point after the calf is born. But once they hit 2 to 3 months of age, they're capable of consuming a fair amount of feed, and their lean growth potential really takes off at that point.
So a lot of people, when they brand calves or bring calves in for their summer shots or whatever, that's when they're probably going to give that implant, about 3 months of age.
And that's an excellent point. There's a lot more calfhood vaccination going on than I was aware of 15, 20 years ago, and that's a perfect time to do that.
Now, one of the questions that's always asked about, we don't know based on the steers. That's one thing. Okay. Now there are two other classes of cattle on steroid implants, and bull calves, potential breeding calves for the herd, and then replacement heifers. And what are some of the recommendations that you're seeing out there in the industry on those two classes of animals?
Again, I try and keep my recommendations fairly clean, and the simple one on heifers is if you don't know for sure whether you're going to sell those as market cattle or potentially use those or sell those as replacement heifers, I would recommend we forego the implant.
So don't do it.
Don't use the implant on heifers that you're not sure may be replacement females. And the reason for that is not that there's an abundance of evidence that says the implants do anything negative in that heifer. The point is, market cattle we sell by the pound, and that 15 to 20 extra pounds, we know what that's worth. In a replacement female, there is a small amount of evidence that says if done incorrectly, we could potentially lose a little bit of fertility in her, and it's just not worth the risk.
And I definitely stay away from implanting bull calves that we potentially will keep for breeding purposes. There's really no need to do it.
Exactly. I agree with that. Those intact testicles, especially as that calf approaches weaning time and approaches maturity, those are his implants, and to implant that calf really doesn't give us anything additional.
So in a nutshell, if you think you're going to keep them as replacement heifers or don't know, don't implant them.
If, on the contrary, if I know for sure those heifers are going to be feedlot heifers, by all means, use the implant.
Use the implant. So steers, heifers sent to the feed yard, we're going to implant those. Those for reproductive purposes, we're not going to do it.
Agree.
Thanks for watching Doc Talk, and we'll be right back after the break.
This tip brought to you by Baytril 100 Enrofloxacin Injectable, now approved for use in controlling BRD in high-risk cattle. Baytril 100, right the first time, whether it's controlling BRD in high-risk cattle or treating BRD.
Hi there, I'm Dr. Dan Thompson. Welcome to Bayer's Farm Animal Health Tip today. We're going to talk about preventing calf scours in baby calves. And the big thing about the two main points of preventing calf scours in baby calves is the immune system of the calf through colostrum and the environment in which that calf lives in. And there's two reasons for the environment. One is to decrease the amount of pathogens present, and number two is to make sure we give those animals a nice warm place to lay down. Colostrum is important. As soon as that calf can consume colostrum, and definitely within the first 12 hours, we want to make sure that calf gets up, sucks, and has a good intake of colostrum. For the environment, we're talking about keeping the areas dry, providing bedding, making sure that we change that bedding, and we have a place where that animal has an opportunity for its immune system to do well when we're trying to fight off disease. Two big things for calf scour prevention: colostrum intake, environment. I'm Dr. Dan. Thanks for joining me.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
Dr. Dan here. Whether I'm driving up and down the roads covering the state of Kansas, or I'm getting between Riley and Manhattan for my job, I'm driving a Ford truck. I'd like you to come out and visit my friends here at Dick Edwards Ford. They have a truck that'll suit your needs, whether you're looking for power with a Power Stroke diesel, or if you're looking for fuel efficiency with the new EcoBoost engine, they got a truck that's just right for you. They're located 2 miles east of the Town Center Mall in Manhattan, Kansas, and they'll bend over backwards to help you. And I'll see you down the road.
Getting ready to work cattle for pre-breeding and calf vaccinations? There's no better time to use a safe, modified live virus vaccine to prevent BRD. Titanium provides the correct equation for BRD with its excellent safety profile and a strong response and long duration of immunity. Ask your veterinarian about modified live virus vaccines and the 8 convenient combinations of titanium for the perfect pairing of performance and value.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by Purple Wave Auction, the easiest, most straightforward way to sell used equipment. Purple Wave, straight, simple, sold.
Hi there, and welcome back to Doc Talk. I'm Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University, joined by Dr. Chris Reinhardt, who is the feedlot specialist for the state of Kansas and an associate professor over in the Department of Animal Science and Industry. And we've been discussing implanting suckling calves and what program to use, which animals that will receive it, which ones won't. And the one question, though, that I get a lot in the feed yard industry is, or from people who are going to sell those calves, is people tell me that if I implant the calves on the cow, they're going to be worth less at the sale barn or have less potential for growth in the feed yard or less responsiveness to subsequent implants, a whole bunch of different questions that you get. You keep things simple, but this one might test you.
Well, I'll try and clarify. There was potentially 1 or maybe 2 studies done in the late 1970s, early 1980s that said a calf that got an implant while suckling was less responsive once it got to the feedlot. That study, for the last 30 years, we've tried to replicate and duplicate those results and really haven't seen that. So the vast majority of the data says the calves continue to respond to implants essentially the same way. And so what I tell ranchers is yeah, they're going to get the value out of the implant on their dam, and they're going to get just as much value at the next stage of production.
So there's really there really isn't much to worry about as far as, especially in, you know, the other question, there's two types of calves. There's the ones that are going to be sold to somebody else, and the ones you're going to retain ownership in. And definitely, if you're going to retain ownership, you know, those are the ones you probably want to make sure you get implanted as a suckling calf.
If you're going to retain ownership, what I tell people is the 20 extra pounds they put on while they're on their mother, they will have that 20 extra pounds for their entire life. They'll go out of the feedlot weighing 20 pounds heavier than the calves who didn't get that Calfhood implant.
Maybe finish earlier, less days on feed, different things like that that are all economic signals to making or not making money.
Pounds is king, Doc. You know that.
That's right. All right. So coming into a feed yard, do you adjust your implant strategy based on whether the calves have been implanted or not, or are you just going to use your implant strategy based on the weight of the animals coming in?
I wouldn't adjust anything, and the reason goes back to what we said earlier. All of the implants we've got available in our marketplace are designed for a specific weight of calf and a specific nutrient intake, and these calves are coming in weighing 500, 600, 700 pounds. They're eating a lot of feed compared to 20 or 30 years ago. They're going to be able to handle a higher dosage of implant than that baby calf on its mother.
Yeah, great points. I think it's something that when we start to think about developing steroid implant programs for the life cycle of the calf, all of these things need to be taken into account. We're going to take a break, and then when we come back, one of the things I want to discuss is some research that we've done here on kind of that weaning calf strategy, whether to implant, whether not to implant, delaying it, and such. Appreciate you being here. Appreciate you watching too. We'll be right back after the break.
This segment is brought to you by Lalaman Animal Nutrition, dedicated to the development and production of natural and differential solutions for animal nutrition. And by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
This is Agriculture Today from Kansas State University. A great deal of drought-stressed corn turned up with high levels of aflatoxin this year, a substance that can greatly hamper livestock performance. That corn can still be safely used for feed if processed properly. K-State's Joel DeRushi outlines one step that can be taken to lessen that aflatoxin level.
One of the most practical things we can do, if available, is simply cleaning the grain. The toxins, all mycotoxins in general, are generally associated with the broken kernels, the stress kernels, and are in the dust. Well, when we clean corn and get that dust and the small broken kernels off, we can easily reduce the aflatoxin load by over half.
This is K-State Research and Extension.
The Kansas State University College of Veterinary Medicine is a leader in food animal research and education. Our researchers are constantly expanding the knowledge of animal health and food safety. Through the Veterinary Health Center and the Kansas State Veterinary Diagnostic Lab, we provide practical services for animal producers. Home of the Beef Cattle Institute, the college is committed to animal welfare training and research. The Kansas State University College of Veterinary Medicine, knowledge and service for the future of animal production.
Cow-calf, stocker, and feedlot producers know that effective parasite control improves overall herd performance and profitability. Norbrook offers a comprehensive, economical line of pour-on and injectable parasiticides for every livestock operation. Consult with your local animal health supplier to set up a program that protects your investment and brings larger cattle checks this fall. See for yourself why the Noromectin line from Norbrook is the practical choice for your herd.
The Kansas State University College of Veterinary Medicine is a leader in food animal research and education. Our researchers are constantly expanding the knowledge of animal health and food safety. Through the Veterinary Health Center and the Kansas State Veterinary Diagnostic Lab, we provide practical services for animal producers. Home of the Beef Cattle Institute, the college is committed to animal welfare training and research. The Kansas State University College of Veterinary Medicine, knowledge and service for the future of animal production. This segment is brought to you by Rotomix, manufactured in the USA and designed for feeding performance in the feedlots, beef production, dairy, and cow-calf operations.
Hi there and welcome to DocTalk. I'm Dr. Dan Thompson and we're wrapping up our segment on suckling calf implant strategies, and the best way to wrap that up, Dr. Reinhardt, is to move on to weaning. Dr. Reinhardt, if you haven't been with us in the previous segments, is the state feedlot specialist here at Kansas State University and an associate professor, a nutritionist by training, who's done a lot of work with steroid implants out in the industry, many different companies that you've either worked directly for or indirectly for. And so it's nice to have your type of recognition and experience with these products here on board at Kansas State University. And so now, one of the questions we get is if I implant the calves as I wean them, I'm going to decrease the health status of those calves, specifically with bovine respiratory disease. What's our research say? Kind of put him on the spot here.
What I like to say about that, I'll call it that theory, was it was a theory based on maybe some defensible ideas, but there really wasn't any data up until a year or so ago. And we ran a very large, well-replicated study here in Kansas in a commercial feed yard with truly high-risk calves coming in that had a long haul on them, and there was quite a bit of morbidity in those calves. And the simple design was either give them an implant on arrival or delay that implant and let those calves kind of get over that stress. And again, the long story short was there was no advantage of delaying that implant.
Yeah, and when you take a look at it, whether it was morbidity, mortality, there might have been some trends there, but nothing significant. But the thing that there was, for every trend that there was on the health side, there was a positive trend to giving that implant up front on pounds of carcass and pounds of outweight. So really no deleterious effects in my mind.
Well, the thing I always say is you might have a set of calves with 30% morbidity in those calves. What that sort of means is I've got 70% healthy calves in that pen who are stepping up and eating every day, and if we decide to not implant because of a very small number of calves that may not respond immediately to that implant, number one, we're giving up performance on the other 70, 80, 90% of the pen. But the other thing to remember is, too, calves get over being sick, and then they begin to eat well and respond. They will respond to that implant. We give up pounds every day we don't have an implant in those calves.
Well, I think it's been a great segment, whether it's talking about making sure you implant those calves while they're suckling on the cow, specifically the steers and the feeder heifers. Maybe on the ones we're going to use as replacements we're going to stay away from, and that the programs really don't have a big effect, the ones that we use on the cow, on the calves in the feed yard.
None that I can find.
Sure appreciate you being here today.
It's a great opportunity.
And thank you for watching DocTalk. If you want to learn more about what Dr. Reinhardt and I do here at Kansas State University, you can go on the web at www.vet.ksu.edu. Remember, we recommend that you always work with your local veterinarian. Again, I'm Dr. Dan Thompson here from the College of Veterinary Medicine. You've been watching DocTalk. We appreciate you watching the show, and we'll see you down the road.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
DocTalk, produced in cooperation with Drovers Cattle Network and Bovine Veterinarian. For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Multimin USA, manufacturers of Multimin 90, sure trace mineral supplementation by timed injection.
There are two problems with trace mineral intake in beef cattle. One is simply that intake of trace minerals can be slightly unpredictable. The second thing is that other minerals that are present in the diet in high proportions can actually interfere with trace mineral absorption. Sulfur is a classic example of this problem. Many of the feedstocks we use, like distiller's grain and corn gluten feed, are high in sulfur. In some cases, groundwater and surface water in Kansas can be high in sulfur. When dietary intake of sulfur is high, that means that copper in particular and also possibly zinc can be absorbed from the gut in less than ideal proportions. When injecting a trace mineral product, you bypass that source of trace mineral antagonism in the gut because the injected product is taken directly into the circulatory system for processing in the liver and deposition in the various storage sites within the body. A breeding female's body reserves for trace minerals are a little bit like a bank account. When there are periods of demand in that breeding female's life, her bank account of trace minerals is rapidly consumed. I mean, two examples of critical physiological periods of need would include parturition, lactation, and then breeding that immediately follows the initiation of lactation. During these periods of time, the breeding female's body reserves of critical trace minerals are being constantly drawn down. In my opinion, the use of Multimin 90 allows a producer the option of assisting a beef female to perform at her genetic optimum through an optimized trace mineral nutrition program. It's possible to incorporate Multimin 90 treatment in conjunction with other health protocols such as vaccination for respiratory disease and clostridial diseases.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.